So in other words, due to something in the CT reconstruction technique, there's the attenuation values of the patient's tissues are not being accurately reflected in the attenuation values in the image which is produced. So that's what an artifact is. And in this session, we'll be trying to see what are the different kinds of artifacts, what are their causes, and how do we prevent them in CT imaging. So let's keep going. So there's a few different types of causes of artifacts. So the main ones are hardware, something to do with the slice thickness or the beam, something to do with the patient, something to do with the mode of scanning. So if it's helical scanning, there's some artifacts which come into place there. So what are the types of hardware artifacts that can be caused? There's detector sensitivity variation. So that's when some of the detectors are faulty, or when the detector gain amplification is not adjusted relative to each other. So then we'll have an artifact which is caused by sensitivity variation of the detectors. There's also partial volume effects which occur. That has to do with the slice thickness. There's artifacts which arise due to, a cone-shaped beam, which we'll see. With helical interpolation, when structures change in the axial direction, there's changes in shape, etc., due to the fact that the motion is that of a helix. We won't go into that much detail. There's also artifacts which are relating to the patient, such as beam hardening, photon starvation, presence of metal in the patient's body, due to the contrast medium which the patient has been injected with, when there's motion or when there's an insufficient field of view. So what happens in this last case where there's an insufficient field of view is that we'll go into these artifacts in detail a little later on, but these are the main causes of artifacts, the main causes, as well as the artifacts listed for each one. So how common is each artifact? So the majority of artifacts are patient-based, 78%. This is taken from Common Computed Tomography Artifacts, Source and Avoidance. So it's a research paper by Amel F. Alzain and others. So what we're seeing here is that patient-based artifacts predominate the most. Then we have, the technician makes a mistake, due to the physics of the system, scanner-based, and due to the fact that we're using a helical technique. So you can just see how common each of these different artifacts are. So first, let's look at detector sensitivity variation. So what happens here is that an element in the array is faulty, and you can see in the image there that in the detector array, there's one detector which is not working properly, which has been shaded in. So that is the faulty detector. And what we need to realize is that when it comes to the locus or the line of sight of the faulty detector, as the X-ray source rotates, the line of sight of each detector is in the form of a circle. So yeah, this either happens when an element in the detector array is faulty, or when the detector gains out of adjustment. And as we were saying, the locus of the detector line of sight describes a circle. This is to do with the fact that the scanner gantry is rotating. Yeah. So what that means is that everything that this detector sees is going to be along a circle, and there's going to be an issue with everything that lies along that circle, which is the locus of the detector's line of sight. So this is the artifact that arises from this particular fault in the scanner mechanism. So we can see that when the scan data is back projected, a ring-shaped artifact is seen in the image. You can see that in the diagram on the left-hand side, that there's a ring-shaped artifact which is forming on the screen. So this is due to the fact that everything that this particular faulty detector is seeing is going to be projected wrongly, back projected wrongly, and it's in the shape of a circle because that's everything that particular detector sees. In this case, there's many rings, so this can also happen when the detector gains haven't been aligned together. So this is another image of what these ring-shaped artifacts look like. You can see it in a water-filled phantom or in air. And these images are taken from artifacts and CT imaging by E-integrity. So how do we avoid these type of ring-shaped artifacts? We have to do regular detector air calibrations to ensure that individual detector element gains are well adjusted. So what this means is before we start using the scanner, we need to use these phantoms in order to see whether ring-shaped artifacts exist. And if they do exist, that lets us know that the different detector element gains are not well adjusted to each other, or even if the gains have been well adjusted, if the artifact persists, then that tells us that one of the detector elements is faulty and needs to be replaced or repaired. So that's how we avoid ring-shaped artifacts. When do we need to do this kind of air calibration test where we put a phantom filled with air into the scanner and we see what kind of image we're getting? So this is done when the scanner is switched on, or it's done as a warm-up after a period of inactivity of the scanner. So that's when it's likely that these detector gains will be misaligned with each other. Okay, let's keep going. So we have another effect which is known as the partial volume effect. The partial volume effect, so you can see an image here. This image is taken from a paper titled The Clinical Significance of Partial Volume Averaging of the Temporal Bone. So you can see here that different types of objects, 1, 2, 3, 4, 5, are fitting into the slice thickness in different ways. So number 4 is bigger than the slice thickness. Number 1 is axial to the slice thickness but doesn't fill the entire slice thickness. Number 2 fills the slice thickness. Number 3 is kind of intersecting at an angle. And number 5 is once again coming out of the slice thickness. So what is the partial volume effect? The partial volume effect happens when objects are smaller than the slice thickness. So the types of objects that it would happen for in this image are number 1, number 2, and to some extent number 3. So this is when their thickness is less than the slice thickness. That's when this effect happens. The reason that the partial volume effect comes about is because of the way that the computer reconstructs the images. So the computer, during filtered back projection, to calculate the attenuation value of a certain point, is going to look at all the values which are surrounding that point and then take an average of it. So when the object is smaller than the slice thickness, what happens is the surrounding values will get averaged with the object values. So the object attenuation value is averaged with other material in the slice. So what this means is if you have a high contrast image, it leads to a loss of contrast and resolution when imaging fine structures. We can understand how that would happen. If it's a very fine structure that's smaller than the slice thickness, then there's a loss of contrast and resolution. So we can see that in the image here on the left-hand side, where there's the top image is actually supposed to be white. However, it's gotten averaged with the dark background. And so it's become a gray color instead. So that is when the image is smaller than the slice thickness. So the next two bright circles are when the object is larger than the slice thickness. And the final image is when the object is slanting. So some of it is within the slice thickness in the right direction, and some of it is not within the slice thickness in the right direction. So in that case, we'll get something that looks like the bottommost image over there. So how do we, and that's the clinical example of what that might look like. So if you look at the object which is titled as SP, you can see that it's very bright, and that's the proper attenuation of the metal object in the patient's body. However, the other structures are not as bright. And the reason for that is that they're smaller than the slice thickness, so the partial volume effect is happening. So how do we reduce the partial volume effect? We have to make sure that appropriate slice thickness is used, depending on what is the size of the structures that we're interested in or the structures of interest. We know that as the slice thickness decreases, the image noise actually increases. So when we are trying to reduce the partial volume effect by reducing slice thickness, there's a trade-off which happens between the noise. So the noise increases as the slice thickness decreases, but the volume effect decreases. So you have to decide, you have to find the fine balance at which the slice is thick enough that the volume effect is minimal, and the noise is also such that you can still read the image clearly. So that parameter has to be decided before we work on the partial volume effect. So the next is the cone beam effect. So the cone beam effect has to do with the fact that the detector, the X-ray beam which is used is in the shape of a cone. Now there's two diagrams here. One is of an object which is being imaged by a single slice scanner, and the other by a multi-slice scanner. So in the case of a single slice scanner, we can see that at two different views of the object, it's still the same detector which is detecting the object. You can see that where those triangles are pointing on the detector array, it's the same detector which is imaging the object at different views. However, if we look at the multi-slice detector, what happens is that yellow little ball which is being imaged is off the ISO center. And when it's being imaged by one particular view, the image is landing up at a certain detector. And when it's being imaged by another view, the image is landing up at a different detector. So what's happening is that different detectors are detecting the same object in different views. So when these views are combined together, these projections are combined together to make the image, we'll get some artifacts on the some artifacts in the image. So once again, this artifact is known as the cone beam effect, and it happens when an off isocenter object is detected by different rows in a multi-slice scanner. It's more pronounced at higher bit factors. The reason it doesn't happen in a single slice scanner is because there's only a single row. But what happens in the multi-slice scanner is that it's a different row of detectors which is picking up the object rather than the same row. So the things that we see when the cone beam effect happens is apparent elongation and distortion. And the cone beam effect can be minimized by reconstruction algorithms. So there'll be elongation and distortion of the object that's being imaged, which doesn't actually exist. And the way that it can be minimized is by reconstruction algorithms, which take this into account and remove the factors of it by at the, whether the effects can be reduced using an algorithm or not.